and kind of became these evangelists basically for it, which I mean in positive terms, and decided that they were going to fund and set up this nonprofit and advertise in countries such as Ireland and the UK and the US and Canada were the main ones, saying this really worked for our company. If you're interested in doing it in your company, we'll provide you with some support. It wasn't a huge amount of support. It was a few months. So there was an on-ramping period. You got set up with a buddy of another organization in your sector who were also implementing a 4-day week. So you kind of had that peer support. Very importantly, that 3-month kind of on-ramping period was really what set apart companies who made it versus when we look at studies of kind of more one-off companies. If you jump into this, it generally companies kind of fall apart in the process. But this on-ramping process and this support operationally really was helpful for these organizations. In addition, they partnered with us. So Juliet Shore is the principal investigator, and Wen and I and Golin kind of were the core team. And we went to webinars, explaining to the companies that we provide research support. So we collected data from them, and then we were able to email their employees. We did interviews with them and so on to try to kind of understand how this was all going. The key part of this is it's based on, Andrew Barnes has trademarked this, the 180-100 model. And basically it's you commit to 100% of organizational output for 80% of the time and 100% of the pay. Because the 4-day week exists in many other countries. So for example, in the Netherlands, everybody has the right to request a 4-day week, but it comes with a commensurate pay cut. And in such circumstances, not everybody is going to take it up, right? So if you think about it, you tend to have an overrepresentation of women. You have, if you can't afford to take that 20% reduction in pay, then you're not going to do it. So there's a lot of kind of social equity parallels that this model kind of overcomes. The 100% of organizational output is really key here as well. Part of that hand-holding process and kind of company onboarding really encouraged workers or organizations to think about what is it in your organization that's working, what's not working, where are those low-value activities that you can get rid of, and there was a huge emphasis on getting the solutions from the employees. So this wasn't top-down. I mean, it varied across organizations, but there was a big effort kind of from management and employees to come together to say, okay, if you want this to work, if you want it to last, we have to come up with solutions. And that really came out in the interviews with the employees as well, this kind of sense of collective ownership. How did people do it? So I like this Dilbert cartoon because it talks about how much time we spend in meetings. And it just kind of makes the point, anybody who sat through a faculty meeting or anything else knows exactly what this is. You get into this downward spiral of meetings about committees, about meetings, and then all of a sudden it's 4 p.m. So it just, that's one of the big things that happens within this organization. They eliminated low value activities is what they called them. So they had started having 15-minute meetings and different things. We were interested overall, and this all happened very quickly, but we wanted to see what the impacts would be on productivity and profitability, social outcomes, and environmental outcomes. So I'm an environmental sociologist. I actually am the lead PI. She's an economist and works in environment as well and workplace. So it was kind of this intersection we were interested in. The environmental outcomes proved very difficult to measure for things like privacy concerns, and because we were looking for energy bills and so on. The economic, a little bit better, but companies wanted to keep some of that to themselves, and it was hard to compare across companies. Where we've had the most robust data and the clearest findings is with these kind of social outcomes, what the real life differences have been for employees in terms of well-being, life satisfaction, time use, and looking at inequalities through that. So I'm just finishing a paper, for example, of how it changed gender and time use on the basis of gender and parental status, for example. So basically what we did in terms of data collection, we did before the companies told the employees that this was definitely happening. We did a survey amongst the employees looking at baseline levels of many things, satisfaction with the workplace, health, self-perceived health, well-being, and so on. We did that again during the trial, and we did it 6 months into the trial. At the midpoint, among certain groups, we did a check-in and we got them to recreate their latest day off in a time use diary so we could see what people were doing. And then throughout and at the end, we did interviews with people and with the employees and management to see how it all went. So there was a lot of different waves of this trial, largely, so actually there was more waves than this, but what I'm going to talk about today is among Anglophone countries. So between February 22 and June 2024, we had 6 cohorts, so 153 companies and 5,245 employees at baseline. We lost about 30 to 40% of them with attrition. You are all in a department that does intervention studies, so everybody understands that your baseline number never ends up being your end line number, but that's how many were part of this trial. And actually, if we count everybody, that was kind of companies that dropped out and all the countries that were in, even non-English speaking countries, it's up to about 9,000 employees that were involved in this over 3 years. So it was a pretty big movement, thinking where it came from, just, one individual getting it off the ground and offering support to companies. So these were all companies that self-selected in. So they're not representative of every company in the world. The employees are not representative of that whole country. So that's important to bear in mind, and it's a limitation. But it's still the first study that we have that's across sectors, that's across countries, that's across time periods. And in this particular, I'm just going to present the results of a paper that we published a couple of months ago in Nature Human Behavior about the impacts on worker well-being, and Nature gives the conclusion surprise away in the title. It helped, so no big surprise there. But what we were interested in is how workers' subjective well-being changed. We wanted to know that did the extent of which this well-being change depend on how much time the workers took off. So it's the 180-100 model, but again, these companies are opting in. Nobody could tell them, or even within each organization, the individual employees, how much work time they needed to reduce. So it didn't end up being 80%. But it went down the average. The median value was about 5 hours, an extra 5 hours a week, and the average was 40. So it was pretty good. And then we were really interested in understanding the mediators to well-being. So what are the pathways? So people are saying, yeah, I feel better. But through which pathways, in what way? So what do we know from existing data? So when we started, how am I on time? When we started, half an hour, okay. When we started, we knew from kind of those existing studies that in general, we see positive health outcomes. Again, a lot of this is self-report, but there is beyond self-report, there is a big evidence base from public health studies that show overwork so more than 40 hours has big impacts on physical health outcomes and mental health outcomes. So that's very well established across countries, huge cohorts. In terms of work time reduction, going from the standard 40-hour to less, does the relationship go in the other way? There was a couple of RCTs, randomized control trials in Sweden, that showed improvements in stress and sleep quality. Icelandic trials, again, that large one that happened between 2015 and 19. Again, we saw people talked about having more energy and well-being and so on. But we don't really know or understand the pathways. So to kind of hypothesize what these pathways might be, we drew on Bakker and Jamuti's job resources model. And basically it's pretty, they are applying it, and it kind of comes from looking at job performance. So what they're saying is, okay, if we want to look at how well an employee does in their job, it's down to the resources that they get in jobs. So support, how they're feeling in their workplace. Is it toxic or is it super supportive? The personal resources that they have, underlying factors, just individual demography here and other things, and then the demands of the job. And they really said that, okay, the resources and demands, a really important part of understanding the extent to which that can enhance worker well-being and job performance is down to job crafting, if they have autonomy over kind of setting the terms of their job. And So even if you have an exhausting job, if you have kind of some element of job crafting that you're able to say, okay, I'm going to work longer hours this week, but then next week I want this time off, or etc. So that notion of kind of autonomy plays an important role. So this fit perfectly with the 4-day week, because in this particular model as well, it kind of came with this work reorganization. Job demands, people were spending less time on the job. So even if it was demanding, those demands were less. And then the job, if we think of personal resources, this other kind of source of, whether or not you perform well in your job, they're going to be, we don't know for sure they're going to be up, but people have more of an opportunity to invest in their resources like sleep, exercise, well-being, and so on. But we don't know for sure if that was going to happen. Okay, so we came with the following hypotheses. So we hypothesized that trial companies would improve well-being more than controls. We expected we had 4 well-being outcomes, which is actually, it's on another slide. So it was 2 related to workplace, so burnout, job satisfaction, and then we asked about mental and physical health. And we expected the first 2 to be more directly affected because it's directly related to the workplace, and it was only 6 months. And we know that, changes in physical health take longer. And then this 4th part was really trying to get into the pathways here. So what is it? If we do see people say their mental health is better, why? What are the changes? What are the things that mediate the relationship? How do we understand what's happening here? So we, to that last question, we had, our theoretical model had 3 different levels of mediation. So the organizational level, so we looked at, on average, in your organization, if everybody, your organizational level work hours went down, we're looking at that as a key indicator. What are the mediators if that predicts well-being, and what are the mediators at an organization and an individual level that kind of can explain to us why this effect is happening? And then at the individual level, if we look at how much that one individual changed their work hours, we expect to see effective well-being, but then we have these other mediators, things that we think are being shaped by the fact that this person has reduced their work hours. And how do we understand that as the pathway to well-being? So the first kind of is looking at group effects within the organization. Is everybody less sleep deprived, and is that, something better? And then we're kind of the more direct, kind of intuitive relationship as well. We used we tortured these data because of our reviewers, but we used lots of different analytical approaches, but primarily mixed effect regression models with employees nested within organizations. So our outcome variables, as I said, so 4 well-beings, we looked at burnout, and we had to limit the burnout questionnaire is quite long. We limited it to 7 questions. We looked at job satisfaction. So we took that from the Gallup survey and all those international surveys on workplace well-being uses it. How satisfied are you with your job, 1 to 10? And then we used a single item from the EU's SILC annual survey, and that looks at, it's a single item as well. How would you rate your mental and physical health on a scale of 1 to 5? And then the mediators, so these are our pathways that we're trying to understand how it is that work time reduction affects these outcome variables. We look at drawing on this job demands resources theory. We look at workability, so that's kind of job crafting, and that's a single item compared to your lifetime best. How do you think you're working these days? We looked at job demands, so that is from an EU scale as well, looking at how demanding the job is. We looked at schedule control, again, to kind of get a sense of how the workplace dynamics are changing, and then work relatedness. So this is an existing scale that we use sub items for, and it looks at, it's kind of getting to how pleasant or toxic your workplace environment is, basically. Do you feel appreciated? Do you get on well with your colleagues, etc.? And then we had all manner of controls, so individual level, gender, race, ethnicity, whether they were working from home or not, whether, what month it was, employment type, occupation, whether they were remote or hybrid. And then for all the outcome variables, we also had baseline levels. So it was really kind of getting a change here. And then we had organizational level. And then the key kind of variable that we're looking at here is the work time reduction. So in order to do this, people had to reduce their work hours, and there was no guarantee that that was going to happen. So that was a hand-wringing moment, but luckily they did. And if we bunch them, looking at the individual level, so about 27%, 28% of the workforce reduced by 8 hours or more, 5 to 7 hours, 22%, 1 to 4, 18%. And then the no change, so that was about 23% or so. People, no change, and a small number actually increased. And then within that bucket, we also include 9%. We had a small control group as well, of about 300. And then if we bunch it by company level, so on average, if we're looking at, Oxford University as the company group here, 4% of companies had, with the average reduction was 8 hours or more. 55% of companies, it was 5 to 7 hours, and then 1/3 were in that 1 to 4 hours, and then 9% of our sample were this control. So people get it like we're looking at two versions of work time reduction here. What's the company, what's happening overall, and what's happening at the individual level. Okay, so I'll kind of jump straight in because we're running low on time. So we predicted that trial companies would improve well-being more than controls. So if we look here at, this is just descriptive statistics with a few t-tests, and then we ran some other follow-up here. We can see baseline to end line. So burnout, we see all the zeros, statistically significant changes across burnout, satisfaction, mental health, physical health. No statistically significant change across any of those 4 indicators compared to the control group. So then we, did t-tests, and we also did models looking at, trying to control for time and other things. And the results held that, the intuitive change here, that there was a positive impact in trial companies and no change in non-trial. And as I mentioned, there was an average of a 5-hour change at the company level and 4.72 if we look at an individual level, no change within, as we'd expect, within the control companies. And the second is we expected the biggest burnouts to be job satisfaction and burnout and job satisfaction. If we look at the change here, so these 3 are on the same scale. Actually, no, we did see mental and physical health having large changes here. So they were kind of similar. We didn't, across all 4 outcomes, we saw shifts. We expected that the more time people took off, the bigger the impact on well-being will be. So if you focus just on the black dots here, so the more intuitive one is this individual level changes. So I'm Orla, I've reduced my hours by 8 hours. We see that as we predicted, the more you reduced your hours, so this is 8-hour reduction, 5.7, 1.4, we see this bigger reduction in burnout, similar for job satisfaction. So the changes kind of go in the way that we expect at the individual level, and we don't see significant results in changes in physical health for people who only took 1 to 4 hours off. So the findings kind of, it depended. It was very much as we expected. And then the white dots are just when we add in the mediators. So same kind of effect, a bit smaller. Then at the company level, so the extent to which, if the unit of analysis is the company, we don't actually see this clear dose effect that we see at the individual level. It's actually kind of different. So it's here, if say, let's look at job satisfaction, it actually goes up more in the 5 to 7 hour group and 1 to 4 hour compared to 8. It's not a clear pattern. So it's not as clear cut, not as clean a story if we look at the company level reduction. And then if we look at effects, so here we're trying to get at the pathways to changes, why we saw the effects that we saw. Company level mediators, so if on the whole in a company, so we're looking here at the company work hours as a predictor of changes in well-being. If at the company level there was, more sleep, less grumpy people, that explained 14% of the results. If there was a big change in workability, so the extent to which people, there was a sense in the organization that they could do their job well, that explained 4 to 5%. And then if we look at individuals as an explanatory factor as the pathway through which we see that why changes at an organizational level, average work hours have this impact on well-being. Again, same kinds of things, workability, reduced sleep problems, reduced fatigue. And then same for this kind of second, if we're just looking at individual work hours as the predictor of outcome, job demand, decreased job demands, reduced fatigue, increased workability. All of those were the pathways we identified for burnout. So the first variable. The second variable, similarly, looking at, and again, these are workplace related mediators. So some things we might expect: improved workability, reduced fatigue playing a role here as well. And then mental health, here we're looking, sleep problems were huge. So we saw, they predict the changes that we saw in gains in mental health outcomes, looking at the pathway from company level change to that outcome. Being in a company where on average there was fewer sleep problems was kind of the biggest predictor that we saw here. Again, if there were people within that organizations who had a sense of agency and efficacy in terms of how they did their job, so workability, who also weren't as tired and had reduced sleep problems, they were some of the big pathways that explain the results we found too. Same at the individual level, but as one might expect, reduced fatigue plays a bigger role here. People are less tired, their mental health is better. It's sleep is a huge part of this. Physical health, we didn't actually identify pathways for physical health, partly because, well, kind of some of what we started with, right? The changes in physical health, we just mightn't, it's so vast. We didn't have the right variables probably in our model. But we did see in terms of that more clear cut, how individual level work hours predict these changes, the perception of having at least reduced job demands, reduced sleep problems, reduced fatigue, all of them kind of explained partially, depending on how much you reduced your hours, the outcomes that we saw. And I'll just wrap up. This isn't in that Nature Human Behavior paper. We haven't published on this, the qualitative data yet, but I think it helps. So these were interviews I did in Ireland with some of the employees. And I think it gives a little bit of the context to the mental health stuff that we're seeing here. So Sarah talked about life has gotten so much better. Oh my God, like I don't know how people who don't have it can function. And I remember this interview, Sarah was in her 20s and going to lots of weddings. As people in their late 20s often do, and having a Friday, she could get her hair done, you know, not to be so gendered about it, but this is what she talked about. And just being able to do that, go get a gift, do something thoughtful for her friends, having that sense of connectedness played a big role. And the second quote here, the 38-year-old female, parenthood came into this a lot, and quantitatively we see this too. They talk about how with that group, it's kind of hanging on by your fingernails and feeling able to kind of get back was the real message there. So people talk about, I don't know how I was able to manage my life before, I'm feeling like I can breathe again, etc. And then James talked about, before I had the 4-week, I didn't have time capacity for all the other parts of my life that needed attention. Having the extra day is a game changer. And we know from the time you stayed at, people are doing more hobbies, spending more time with friends and family. So that's kind of some of the other nuance to the quantitative findings that we're finding. Okay, so key thing here, no surprises, adding to decades of research, but the workplace really is a fundamental social determinant of health. And if we look at the company level, it's not down to an average company hours. So the more on average the company reduces its work time, we see the better outcomes. It's more nuanced there. We do see that clear dose effect at the individual level. So the more an individual reduces their hours, we do see this kind of effect more clearly. And then the kind of pathways, the mediators, the biggest ones we identified is workability, reductions in levels of sleep problem and fatigue. And this, even though it was probably cumbersome to have to listen to me explain the different levels of mediation effects. In terms of the evidence base, it is kind of new that we're able to show these spillover effects, like the different effects of being within an organization that changes the average hours versus being an individual, and how those kind of complicated pathways work. Limitations, there are many. The organizations don't represent every type of organization. The employee doesn't represent every kind of employee. These are high income nations only. So plenty more work to do, but kind of an advance of the single case, single organizations that we've tended to have to date.